We have with us Evelyn Kortum from the World Health Organization. Evelyn, you are going to do a conference this afternoon about the healthy workplaces comprehensive model. What are you going to explain there?
Well, I'm going to explain a number of things. At WHO, we have a strategy which is called our Global Plan of Action for Workers' Health, which has 5 objectives. And one of these objectives is to protect and promote health at the workplace. And the model we devised, the healthy workplace model, makes justice to protecting workers in terms of occupational health and safety, but also promoting their health. This model contains all the areas that an employer should be taking care of in terms of workers' health. It concerns the psychosocial working environment, the physical working environment, personal health resources, which is your traditional health promotion, but we called it personal health resources because the employer has a possibility to put barriers to people having a healthy life at work, or to provide opportunities, like, for example, in terms of good cafeteria food or opportunities to move around, to do sports, etc. And the last one is the interface with the community, between the business and the community, because our focus is developing countries. And so the communities are very important, and they are also developing economically and in terms of education. So the companies can do a lot for the community. And this is basically the model I'm going to explain.
Do you think that every time more companies and people understand that health in workplaces is more important?
If people understand it, I think they do understand it by now, at least in industrialized countries, because we have had so much talk about it, there's so much research. We know that an unhealthy workplace, unhealthy working conditions can have a very adverse effect on workers' health. And finally, it's the businesses that suffer from it, and they have felt it. They have felt it themselves in terms of return on investment, because sick leaves and absence rates are increasing, actually, which is very expensive for the employers.
Yeah, but all this politics has a cost. You know, has a cost, has a price. You have to pay to have a healthy workplace. And my question was in that way. You know that every time more we are in a crisis. We have to think these kind of things. Maybe business companies think in other things and not in health in a workplace.
I don't think we should think in the short term. When you talk about the workplace, you have to think in the long term, because your business is going to live hopefully longer than only 1 year, right?
Hopefully.
So that if it only did, then you could disperse of the workers afterwards and you don't care. Yeah. But if you want your business to thrive, you have to think long term. And you also have to make your business case and see in how far the interventions you put into place actually come out as benefits on the other side. And a lot of studies show now that investment in workers' health actually pays for the employers and for society at large, of course, because economies, they benefit from healthy workers.